Hi, and welcome back to Body Beautiful. I'm Janelle Marie. With us today, we have plastic surgeon Dr. Joseph Mealy. We're talking about a couple different plastic surgery procedures today. We just talked about breast surgery revision, and now we're talking about otoplasty. I said it correctly,
That's
right?
Correct.
Otoplasty.
Otoplasty.
What is it?
Well, oto means ear.
Oh,
so
okay. I
plasty
didn't know
means
that.
changing, so it's ear changing. Most commonly, it's correcting prominent ears.
So how do you do that? Because it seems like a tough surgery.
It's actually a good surgery in that it's fairly predictable and something we can do safely.
Okay.
The procedure can be done under local with some sedation, or it can be done under general anesthesia because it's an area we can numb up really well. How we fix it depends on what the problem is. The most common problem is that final fold on the upper part of the ear here doesn't form completely, and it leaves the top sticking out.
Oh.
So essentially what I'm doing is just correcting that, just making the fold where it should have been.
Okay.
Other reason it happens is sometimes the concha, the hole where we catch sound, the bell, is too big. And that also acts like a kickstand to push the whole ear out.
Oh, okay.
So in that case, sometimes I'm removing part of that cartilage on the inner part of the ear.
So you just remove the cartilage in the back and then sew it together?
Just a little bit of it, and then it folds back. And you sort of, it does kind of support the ear too much. So taking out a little bit lets it rotate back towards the head.
And so do both sides have to be fixed if you have this problem, or is it kind of more how you see your ears, or is it kind of a problem that can affect your hearing?
Oh, definitely. Everything I do is also depends on my patients. Because if someone doesn't think it's broken, I don't fix it. And there are people with small amounts of protrusion that it's very bothersome, and people with very large protrusions, it doesn't bother them.
Some people can cover it with their hair and they're fine.
So, and it's true, I had one guy who wouldn't take a job promotion because he had to cut his hair because his ears were sticking out, and we were able to fix his ears and he could take his promotion. So
he got the job.
Sometimes it's limited.
Yeah, absolutely.
People worry about it.
Well, let's take a look and see. Picture number one here. Oh, look at that.
So I've got all these from the back just so that it's actually easier to see both ears from the back. In this case, the upper fold didn't develop, so you can see the top of the ears really are sticking out more than the bottom. And what I do is just reform that and bring it back. And the incision's right in the back behind the ear, very difficult to see.
Yeah, you can't see it.
So you can still wear your hair up and not have to worry.
It almost seems like the sides in the left picture are thicker. It's almost like, did they thin down, or is that just cartilage I'm seeing?
It's the cartilage. I think we can see more of the ear.
Oh, okay, gotcha.
Because the ponytail's doing a better job in the picture on the right.
Okay, that's a great job. All right, let's go to picture number two.
And she was so cute, and she came in, her biggest problem after her first consultation was we weren't fixing it that day.
Oh, she wanted it done right away.
Because I always worry about the little kids. I want to be sure they think it's a problem. So I always ask them, does it bother them? And if it doesn't, then we shouldn't be fixing it yet.
Oh.
But here's one side sticking out.
Oh yeah,
so
one side
sometimes
only.
we just fix one side. Sometimes we fix both. Actually, both sides were sticking out enough. We fixed them both. But
you did both of those?
The left side was definitely more prominent.
Wow. His hair looks great in that second picture.
He did have good hair,
He did.
So, and he had the perfect hair to show what I'm up to.
Perfect hair here.
So again, you can see his left side.
Yeah, those are very prominent.
Sticks out a little bit more. Left ear a little bit lower. Real common that they're different heights, but we rarely see both ears at the same time. So if I can bring them back, even if it's not exactly matched, it doesn't matter. It still looks very good.
What about downtime on a procedure like this?
So downtime, sore for the first couple days. And then it kind of depends on how much explaining you want to do. Because it is a little swollen. Not usually bruised, but sometimes it's black and blue. And it may take a week or two.
Or the whole ear?
The whole ear.
The whole ear is black and blue? I got you.
I work, I make the incision behind the ear. I work mostly behind the ear. But in the front, a lot of times I'm wanting to score that cartilage. So the ear itself in the front will get a little black and blue on it.
Gotcha. All right. We have another picture here.
And same idea here. So both ears were prominent, brought them both back. She was wearing her hair up before and after, and it didn't bother her that much in terms of how to wear her hair, but she's just a lot happier, more comfortable wearing her hair.
Absolutely, and that's easy to cover. She's got the hair, so probably didn't have to worry about downtime.
So for recovery, yeah. A lot harder when you have a crew cut.
Absolutely.
But, if you have long hair, you can kind of do what you want to do as soon as you feel okay.
And you were saying local or general?
Can be done local. For the right patient, they have to be motivated. They have to think that's a good idea. If I have a patient who thinks that's a horrible idea, I'm not going to try it. I'll just let them go to sleep. And the nice part about that is they put some medicine in, and the next thing you know, you're done. Yeah.
Well, I wanted to go back to breast revision again because I forgot to ask about downtime on that, and that's very important. So if somebody has to come in and get breast redone again, what's the downtime on something like that?
Usually less than the first time around.
Okay,
usually
good.
less
That's
painful.
What I thought.
So if it's like a deflated saline implant, a couple days.
Okay, good.
Back to normal. If it's something we're really having to remove a lot of capsule, it may take a week. It may take a little longer.
All right, so there you've learned something. Otoplasty.
Otoplasty.
I would have said autoplasty, but you had you here to say otoplasty. Oto means ear.
Both are all right.
It's a learning show.
Yeah.
All right. Thank you, Dr. Mealy. For more information about Dr. Mealy, you can call 925-943-6353 or check him out on the web, drmealy.com or sanfranciscobreast.com. We have lots more coming up on Body Beautiful, so stay tuned. More plastic surgery topics.